In this video, we'll cover anti-arrhythmic drugs. Anti-arrhythmic drugs. So, before going into the details of these drugs, I have some mnemonics or tricks that how to remember these anti-arrhythmic drugs classification. The classification is known as Vaughan-William Vaughan-William classification. This is Vaughan-William classification. According to this classification, we have four types of drug: class 1, 2, 3, and 4. After this, there are some miscellaneous drugs. What are miscellaneous drugs? Like your magnesium, your atropine, your digoxin. So these are miscellaneous. Forget about the miscellaneous. Vaughan-Williams classification divide the anti-arrhythmic drugs into four classes: 1, 2, 3, and 4. And after this division, we'll see that class 1 is further divided into 1A, 1B, and 1C. So this is your classification, Vaughan-Williams classification. So starting with Vaughan-Williams classification, how to remember all these four classes of drug. Suppose this is our heart. This is the heart. If I bring a cardiac myocyte, one cell out of the heart, then let's see the structure. This is your cardiac cell. We know that outside the cell, what is more? Sodium. Inside the cell, what is present? Potassium. This is your heart cell, cardiac cell. It means this cell is having receptor. Which receptor? Beta receptor. Beta 1. So this is the heart made up of cardiac cells. This is our cardiac cell. Inside the cell we have potassium. Outside the cell we have sodium. And on the surface of cell, on the surface of cell, we have beta. If you enter little bit more inside the cell, then we'll find sarcoplasmic reticulum, and this is filled with the calcium. This is filled with the calcium. So this is the normal structure where outside the cell we have sodium, inside the cell we have potassium. Okay, at the surface of the cell we have beta receptor, and if you go more inside the cell, we have sarcoplasmic reticulum filled with the calcium. So if you start moving from outside to inside, what will you find? At the first step, we have sodium. It means number 1, we find sodium. When we move little one step ahead, we'll find beta receptor. If you move inside the cell, you will find number 3, potassium. If you further move, you will reach at the sarcoplasmic reticulum filled with the calcium. So we moved 4 steps. In the first step, there was sodium outside the cell. Second step, beta receptor on the cell. Third, potassium. Fourth, calcium. So these 4 steps, 1, 2, 3, 4. This is your Vaughan-Williams classification. It means the drug in class 1, they are this. They are your sodium, blocker. They are your sodium blocker. In the class 2, this beta, your drug are beta blocker. If you move to class 3, potassium, they are potassium blocker. Then if you move towards 4, there is calcium. It means there are calcium blocker. So this is William Vaughan classification. Very simple. Class 1, class 2, class 3, class 4. Sodium blocker, beta blocker, potassium blocker or calcium blocker. Outside to inside. Second important thing about the class 1. Class 1 is further divided into 1A, 1B, 1C, and this division is based on what happens to potassium channel. Potassium channel. This one means sodium blocker. Sodium blocker. So 1A, what happens to the potassium channel? So 1A drugs are your potassium blocker. 1B are your potassium channel openers. They open, and here no effect on potassium channel. So this is the further classification of your class 1 drug. 1A, 1B, 1C. That is based on what happened with the potassium. If you close the potassium channel, they will come under 1A. Open the potassium channel, 1B. No effect on potassium channel, 1C. So we have classified our drugs, potassium, and inside the sarcoplasm, calcium, that class 1 are sodium blocker, 2 are beta blocker, and 3 are potassium blocker, and 4 are calcium blocker. So moving from outside to inside of the cell. Then further we divided this 1A potassium blocker, 1B potassium opener, and 1C nothing with the potassium. So the class 1 not only block sodium channel if the drug is 1A. So 1A, if I say 1A, it means 1 means it will block sodium and A means it will block potassium. So the drug which comes under 1A category, they will block both sodium and potassium. Similarly, 1B, 1 means sodium, they will block sodium. B means they will open potassium. If I say 1C, because no effect on potassium, so only sodium blocker. So this, in this way, these antiarrhythmic drugs are classified. Category 1, 2, 3, 4. Then we divide the 1 into based on potassium. What happened with the potassium? 1A potassium blocker, 1B potassium opener, 1C nothing with the potassium. So the complete meaning of your 1A sodium blocker plus potassium blocker, your 1A. Complete meaning of your 1B sodium blocker and potassium opener. Complete meaning of 1C only sodium blocker. So these were 4 classes of your antiarrhythmic drug. Now the question comes, how to remember or how to memorize their examples, like which drug comes in 1A, which drugs comes in 1B, 1C, and like this. So if we start with 1A, then 1B, then 1C, then class 2, 3, and 4. The trick to remember this example is based on lifestyle. Is based on lifestyle. If you look at the high societies, the class A people, they live high-fi life. Means their standard of living is A class. So we call them these are A class people. So A class people, they live their life, they live their life just like queen and prince, and also they enjoy some disco parties. So living a life like a queen, like a prince, and enjoying in the disco parties, all these lifestyle is your class A people. So class A people live such kind of lifestyle. They live like a queen, like a prince. They do some discourse parties. They attend these discourse parties. So what is this queen? This is your quinidine. What, who is the prince? Who is the prince? Your procainamide. Your procainamide. What is disco and party? Your disopyramide. Pyramide. So there are three drugs in class A. Means these people they live class A life like queen, like prince, and they also go to disco parties. So queen is quinidine, prince is procainamide, and disco party is disopyramide. So these are three example of your lifestyle of class A people. Next is class 1B. Class 1B. Class 1B people, they comes below the class A. It means all the time they remain in touch with class A people, the hi-fi society people. So what they do, they try to give अपनी maximum service. They try to give their maximum service. So अपनी maximum service. What kind of service they give to these queen princes? They press their legs, they do fan, and they also put some topi on their head. Topi means crown. So the 1B people, they are their standard of living is less than class 1A. So they try to make these people happy. How to make these people happy? By giving their अपनी maximum service. अपनी maximum service. So services may be pressing their legs, doing the fans when they feel some sweating or heat, and also they put the crown on their head because they are the princes, they are the queen. So these people, these lower class people, these middle class people, they are the class A people and they are the middle class. So they always remain in touch with these and try to make them feel happy by doing अपनी maximum help services. So what is apni and what is maximum? Apni means aprenidine. Aprenidine. and maximum means maxillatin. What is leg pressing? Your lignocaine. What is fan? Your phenytoin. Then what is topi? Your tokainide. Your tokainide. So these are the example given in your books, and if you divide them as per the living standard of the class A people and class B, they live their life like a queen, like a prince. They also go to some disco parties. So queen, queenity, princess, procainamide, disco party, disopyramide, and the 1B people they come in contact with, they help them whenever they need. They press their legs, they also fan, and they also put the cap topi on their head whenever required. So they give their maximum services to the class A people. So middle class people help them most. So apne is aprinidine, maxi is maxillatin, leg means lignocaine, fan means phenytoin, and topi means tokainide. So these are 1A, 1B. The remaining drugs they comes under 1C, but we'll check what comes in the class 2 and class 3. So class 2 we have seen these are beta blocker, and beta blocker are the lol person. They carry always suffix lol, atenolol, sotalol, propanolol, propanolol. So they are the lol people. Class 2. So it's very easy to remember beta blocker from the loan. Then there are class 3 people. Their standard of living the life is very much different. So what is their standard? They live a bindas life. They live a bindas life. These are class 3 one. What is B? This is Brityllium. This is your Brityllium. And one more, Buneftine. Your Buneftine. Then what is I? I stand for I stand for ibutylite. Then the drug for your N is your Nifecalent. And the drug for the D is Dronedarone. Dronedarone. And A is Amiodarone. Amiodarone. And S is Sotalol. Sotalol. So the class 3 people, they are free to live. So class 3, they are they are free to live a bindas life. Brityllium, Brityllium, then Buneftine, Ibutylide, Nifecalent, Dronadarone, Amiodarone, and your Sotalol. So these are the four. Then the class 4, these are your calcium channel blocker. Class 4 are your calcium channel blocker. Only verapamil, and they act on the heart, that is dil to diltia jam, because calcium present in the heart to contract the heart, and dipines, that is amlodipine. Their surname is Dipine, Nifedipine, and some other dipines. So there are only three in case of calcium channel blocker. So this was about the classification and how to remember their example. So starting with our lecture on antiarrhythmic drugs. Antiarrhythmic drugs, these are the drugs which control your arrhythmias. So there are two terms, one is action potential, other is cardiac action potential. Because all the drugs they work through these. Action potential means only two, depolarization and repolarization. This is called action potential. Depolarization and repolarization. This is because of sodium channel opening, and this is because of potassium channel opening. So this is the action potential. So what is cardiac action potential? What is cardiac action potential? It means in cardiac action potential will find depolarization as well as repolarization. These two things are common. So this is the resting membrane potential of your cardiac cell. When sodium channel open, it goes up. We call this phase zero. Phase zero. Then potassium channel open. Potassium channel open. This is your phase 1. Here sodium channel open in phase 0. Then potassium channel open. What start? Repolarization. At this point, at this point, calcium also calcium channels also open. So you will find there is phase 3, which is also known as plateau phase. Plateau means there is one horizontal line. Why this line is horizontal? At this point, two channels are open. One is calcium, one is potassium. Calcium comes from outside to inside. Potassium goes into out. So in that case, positive charges coming in, positive charges going out. Things remain constant. Plateau phase overall remain stabilized. At this point of time, calcium channel closes, but potassium channel are still open. So what will start? Again, repolarization will start. Again, repolarization will start. Cell will repolarize and it will come at the resting membrane potential. So we started with our phase 0, sodium channel opens, depolarization occur. Then phase 1, this is phase 1, potassium channel opens, what happens? Repolarization. Then phase 2, 0, 1, 2, not 3, 0, 1, 2. At the level of phase 2, calcium channel also open, positive comes in and positive goes out. Things remain plateau, horizontal, constant. At this point of time, calcium closes, but potassium remain open. That may lead to the repolarization. And this phase is known as phase 3. This is your phase 3. So there are 0 phase, 1, 2, and 3. This duration from this point to this point, this is called your action potential duration, your APD, action potential duration. So this is known as cardiac action potential. All the drugs class 1, 2, 3, 4, they will affect this action potential. So if I summarize action potential, draw a line, then straight, then a small, make it plateau and come down. 0, 1, 2 and 3. These are the this 0 is because of sodium, 1 is because of potassium, and this 2 is because of both calcium and potassium. This 3 is because of only potassium.
So, so hello,
ओके है साउंड।
hello, hello.
ओके है ओके।
इसमें नहीं आ रही वो ब्लूटूथ में।
आ रहा है ओके। कंटिन्यू।
ओके,
सब सब ठीक है। कंटिन्यू कंटिन्यू रख।
these are the four phases: 0, 1, 2, and oh sorry, not four. Four phases: 1, 2, 3, 4. But name is like this: 0, 1, 2, and 3. This is your cardiac action potential. This is your cardiac action potential. So
थोड़ा
what
लाउड
does
बोल।
hello?
आवाज कटने लगी थोड़ी। लाउड बोल। कैमरा ठीक है।
So this is our cardiac action potential, which is divided into four phases: phase 0, 1, 2, and 3. This is because of sodium channel opening, and this is because of potassium. Here both calcium potassium play a role, and here potassium. So let's begin with our drugs, that is class 1. How do they work? So we have class 1 and then 1A, 1B, 1C. The meaning of 1, I told you meaning of 1 is sodium blocker. It means this is your cardiac action potential. The activity related with the sodium channel is this one, this line. So if you block the sodium channel, then this depolarization will be like this. It means there will be slow rise of your action potential. The slope will decrease. This is because of sodium blocker. But in class 1, we have three classes: 1A, 1B, 1C. Let's begin with 1A. So 1A are potassium blocker. Means 1 means they have blocked the sodium. A means they will also block potassium. So which activity on this cardiac action potential is because of potassium? Here, the phase 1, phase 2, and phase 3. At all the point, potassium is playing role. So if you block the potassium channel, then this phase will be delayed, like this. This phase will be delayed. So we can say that our new action potential is this. If I draw in the dotted line, this one. This slow rise or decrease in slope is because of one means sodium blocker, and this part is because of potassium blocker, this dotted line. So what is the result of using these drugs, these class 1A drugs? The result will be there will be slow rise of action potential means decrease in conductivity that we want in arrhythmias. We want to decrease the conduction. The second thing is this one. If you remember, this gap was your action potential duration. If we use 1A class drug, this gap will increase. So two information we derived from our class 1A drug. From class 1A drug. So what are those information? One is they will decrease the depolarization. If I make graph, this is normal, and 1A will 1 means this, they will slow down the depolarization phase. Second, they will also slow down the your repolarization phase. So two things will decrease the depolarization slope, and another is this one. We increase the action potential duration, or also known as refractory period (ERP). So this is the effect of class 1A drugs. So class 1A drugs, your queen, prince, and disco parties. So quinidine, procainamide, disopyramide. So class 1A drug, they will decrease the depolarization slope in this manner, and they will increase the action potential duration, also called refractory period. Clear voice?
एक बार बीच में थोड़ा नेटवर्क का प्रॉब्लम हुआ था, वरना तो ठीक।
ठीक है, ठीक। So again with class
अ-
1 class 1A drugs. In this, 1 means we are blocking sodium. A means we are blocking potassium. So if we look the effect of class 1A drug on the
अ-
cardiac action potential, then because of sodium blocking action, it will decrease the slope of depolarization, and because of potassium, it will lead to increase in the action potential duration. So this is your queen, your princess, and some disco parties. Quinidine, procainamide, and disopyramides. Then class 1B. If you look at class 1B drug, so 1 means they will block the sodium, and B means they will open the potassium channel. So if we look at
आवाज
our
क्लियर नहीं
cardiac, huh? हेलो,
आवाज क्लियर नहीं आ रही। हेलो,
हाँ नहीं आ रही क्लियर।
बीच में 1A के बाद अटक गया।
So class 1A drug, if we compare our class 1A, 1B, and 1C, and just make one then 1A. So what is the meaning of one? We block sodium. What is the meaning of 1A? We block both. Sodium are only blocking sodium channel. Class 1 drug, they block only sodium channel. Similarly, class 1C also block only sodium channel. So the result of only sodium channel blockade will be this. There will be decrease in the slope of depolarization. Means depolarization will
Network failure.
the effect of 1A sodium blocker. So sodium blocker means depolarization.
हेलो.
This effect. हाँ
वो बीच में
हाँ
नेटवर्क भाग गया था.
नेटवर्क दिक्कत दे रहा है.
हाँ,
क्लियर है?
अभी आवाज आई है.
अच्छा. So class 1, 1A, 1B and 1C. 1 means sodium blocker, 1A sodium blocker as well as potassium, 1B sodium blocker and potassium opener, and 1C is only sodium channel blocker. So the effect of sodium blocking is the depolarization. If we block the sodium channel, less sodium come in and depolarization will be slow rising. Second is class 1A, that is sodium blocker plus calcium blockade. This is sodium effect and this is the effect of if we block the potassium channel, repolarization will be delayed. Third is 1B, sodium blocker means this same line. Potassium opener, if we open the potassium, more potassium enter and it will depolarize very early. So in this case, action potential duration was increasing, but in this case, action potential duration like this action potential duration decreases. Then one see only this effect. So these are the three effects where this is sodium and this is 1A potassium blocking effect and 1B your potassium opener that decrease this action potential duration. But this one A will increase the action potential duration. One more important point with the class 1C. 1C are also pro-arrhythmic drugs. 1C are not only anti-arrhythmic, they have some pro-arrhythmic activity which is present only in the 1C. Then class 2, they are beta blocker. They are the beta blocker. They may be non-selective or selective. Selective beta 1 blocker. These drugs they will decrease the arrhythmias by blocking the receptors, either only beta 1 or non-selectively all beta 1 and beta 2. Class 3 drug they are potassium blocker. They are the potassium blocker. It means they will increase the action potential duration. Increase action potential duration. And class 3 people are example are Bindas drug. Out of these, there is one sotalol is having both properties, beta blocker as well as potassium blocker. So
Hello.
class 2 potassium blocker activity of class 3. This is your sotalol. Then class 4 are calcium channel blocker. Class 4. They are calcium channel blocker. L type. L type. Calcium channels may be present on blood vessel and that activity may be on. So there is one drug, your verapamil, have high affinity for calcium channel of the heart and less for the calcium channel of blood vessel. Means the activity on heart will be more and smooth muscles of the blood vessel activity will be less. But the opposite is true for your depends class. Depends. It means amlodipine, nifedipines. These drugs they have more activity on blood vessel and less on the heart. It means these drugs have high affinity for the calcium channels of blood vessels, less with the heart. So these were our class 1, 2, 3, 4 drugs.
Sound. Hello.
Your beta blocker, class 3 blocker, and class 4 was calcium blocker. So total 4 class of drug. Examples class 1A people live like princes, queen, disco, party. 1B they 1B अपनी they try to give अपनी maximum services, that is stretching their legs, giving them fan and toppy. Then class 2 are beta blocker and with the lol, atenolol. Class 3 are your bindas drug. And class 4 are your calcium channel blocker, verapamil and the and last is your dipines, dipines, amlodipines. So this was about the antiarrhythmic